Hi, my name is Kelsey Langford. I decided to do my presentation over Addison disease. This disease is very rare. It's caused whenever your body doesn't produce enough hormones, such as like cortisol and aldosterone. Cortisol helps your body react to stress. So, like, you get stressed about something at work, and this hormone is produced, such as like illnesses and injuries and surgeries and things like that. Um, this hormone also helps maintain blood pressure and heart function. And then the aldosterone helps the body like balance your sodium and potassium in your blood. And with this disease, your body doesn't produce enough of those hormones as it needs. This disease is more of an autoimmune response. So like any trauma or stress can kind of lead up to this disease. It's always gonna be there, but something triggers it. This disease, like I said before, is very rare. So in the US, 1 out of 100,000 people are diagnosed with this. It's seen in both females and males, but it's normally diagnosed between like 30 and 50-year-olds. When looking for this disease, if you think you may have it, here's some things to look for. You may have abdominal pain, cravings for salty food, dehydration, depression, diarrhea, lightheadedness, loss of appetite, low glucose levels, blood pressure, vomiting, extreme tiredness. There's a lot to it. In some cases, injury and illness or intense stress can make these symptoms more serious or intense. This is known as like the Addison crisis. This crisis is like a medical emergency. It's something that needs to be taken care of right away. This attack or crisis, as you may call it, left untreated, can lead to shock and death. To find out truly if you have this disease, your doctor may conduct a bunch of tests, but for your benefit, it will let you know if you truly have it or not. Of course, they'll do a history and physical. They'll draw your blood to check your sodium levels and potassium, your hormones for the cortisol and the aldosterone. This just kind of lets them know what levels they're at and if they're low, high, just what it goes with. They'll also do possibly like X-ray or CT scan. This will show like calcium deficits, or if how your immune system's looking, if your adrenal glands are damaged, or if like there's some kind of infection going on with your adrenal glands. When finding out that you have this disease, it's best to talk with your doctor and decide on the best course of treatment and start trying to live the best you can with this disease. Your doctor may possibly just prescribe you with the hormones that your body lacks to produce. These medications can be hydrocortisone pills, like to replace your cortisol, or a fludrocortisone pill that will make up for the aldosterone. People with this disease live normal lives. They do well. And some are more serious than others. So let's say your doctor doesn't want to put you on any serious medicine or anything like that, or you think you just want to see how you can do without it. People normally crave salt in this diet, so it's not such a bad thing with that, because they actually want your salt increase. They want you to increase your salt. So with this, you can add, salt to your foods. You really want to do this, especially when you do a lot of exercise or like excessive sweating and things like that. Most foods already have some kind of sodium in them, so like soups and chicken and peanuts and things like that are more healthy for you, but also have that sodium that you may need. Although there's a lot to this disease and a lot that you have to take care of and watch out for and things like that, it's manageable. It can be taken care of, like I said, with medication and daily exercise. If treated correctly, people are fine. You may never know that you have it. You may have some episodes, but other than that, you may be fine. This disease really can't be taken lightly, though. You should let those around you be aware of your disease and, what things can happen if there's some kind of emergency. And it's also best to keep some kind of like bracelet or card with you. That way, if like any accident happens or something, like medical workers will know what's going on and how to help you best. And that's all I have. Thank you.